Good evening and thanks for joining us. There is no way to sugarcoat the trajectory this country is on when it comes to COVID-19. Cases are going up. They're accelerating fast in some regions, especially in people aged 20 to 39. And if you're tired of hearing it from people like me and from public health officers and political leaders, just look at the numbers. This is the graph from the newest federal projections. If we keep doing what we're doing now, case numbers will skyrocket in the coming weeks and months. If we increase contact with other people more than we're doing now, the virus will spread even faster. But if we step up precautions and decrease who we come into contact with, public health officials believe we can get COVID cases back to a slow burn. Here are today's daily case numbers. These are people who became infected sometime in the past 2 weeks. The bulk of new cases are still in the 4 biggest provinces. Ontario is reporting 478 new cases today, the biggest jump since May. Quebec has almost 500 new cases. Out west, there are 150 new cases in Alberta and 96 in BC. Right now, Canada is at a crossroads in the fight against COVID-19. And if we don't act fast to slow the spread, public health experts warn we're headed down a dangerous path. David Akin has our top story tonight.
My message today is the time is now. We're at a bit of a crossroads.
A crossroads, Canada's top public health official says, a choice between continuing with schools and businesses reopening or a potential return to the lockdowns of the spring.
It's not surprising to have increasing cases in the fall. We've actually said this can happen. But now you gotta just keep things under control without the full lockdown.
Dr. Theresa Tam said this unsurprising new wave of infections, the second wave, is different from the first wave.
This surge is a very different surge to the previous wave. It is younger people. Right now we're seeing that the mortality is lower. The hospitalizations are lower.
But that could quickly change.
It's going to spill over into high-risk populations.
Hence, a call by Canada's health minister to show more self-restraint.
We have to get better at saying no more than yes to the invitations that we're receiving to gather for barbecues in the backyard or parties to celebrate occasions.
Another key difference this time, much higher testing capacity and more knowledge about tracing and breaking the transmission chain. Those factors may help smooth the transmission curve into some lower peaks and valleys.
We want to keep it at low moguls. We don't want it to go up a giant ski hill and down again.
And to keep the rate of transmission at what Tam called a slow burn, she said it's crucial Canadians do their part. Wash hands frequently, maintain physical distance, wear a mask when distancing is difficult, and stay home if experiencing any symptoms, even mild ones. And local public health authorities have to do their part too, with beefed up testing capacity, robust tracing, and resources to respond to outbreaks. As for the federal government, look to tomorrow's speech from the throne for commitments to families to give them the financial cushion they need to make the right health decisions, and commitments to provinces and local health authorities to give them the resources to beat the virus back. One final thing, Donna. Prime Minister Justin Trudeau plans to give a televised prime-time address tomorrow to underscore the urgency of dealing with this second wave.
David Akin in Ottawa, thanks. The family of Conservative leader Aaron O'Toole, who has COVID-19, is dealing with another setback. His wife, Rebecca O'Toole, has now also tested positive. The Conservative Party says the couple's 2 children are being monitored for symptoms. The City of Ottawa is cracking down on rule breakers. A record 93 new cases of COVID-19 were reported there today, and the city's chief medical officer has ordered that anyone who has the virus, has been in contact with a positive case, or is waiting for a test result will be fined up to $5,000 a day if they don't self-isolate for 14 days. And Ontario announced today what it says is the largest flu shot campaign in that province's history. It's investing $70 million to administer 5.1 million doses of flu vaccine to residents. It's part of a 6-pillar plan to prepare for a second wave. Health officials warn it could hit even harder than the first, though as Jeff Semple reports, the healthcare system this time appears much more prepared.
The first wave of COVID-19 last spring sent hospitals scrambling, building more capacity and canceling non-emergency surgeries. Fast forward 6 months, they're looking and sounding much more prepared for a potential second wave.
It's such a different scenario from March and April. We know about our PPE, our personal protective equipment. We've got lots of it. We have a stable supply. We communicate a lot with each other.
Canada's COVID-19 cases are climbing to levels not seen since early May.
How you define the second wave is up for grabs, but all the indications are that we should be very concerned with what's happening.
This Calgary hospital is suddenly scrambling to contain 2 COVID-19 outbreaks, which have killed at least 2 patients and infected around 20 others.
And those are still under investigation, so we're still trying to determine exactly how the introduction happened.
The good news for hospitals is that the vast majority of new COVID-19 cases are young adults in their 20s and 30s, few of whom require hospitalization. The potential bad news? What happens when the COVID-19 pandemic meets the flu season?
Certainly that's something that causes me to consume a lot of Tums worrying about that.
This Toronto area hospital, which just built this pandemic response unit, typically runs out of beds during a regular flu season.
We need to place a great deal of emphasis on making sure that we mitigate the effects of the flu season, that everyone gets their flu shot.
To that end, Ontario just announced its largest ever flu vaccine campaign, ordering more than 5 million doses.
But the next wave, it will come at us harder than the last one.
Quebec, which has already declared its second wave, is now urging healthcare workers, including dentists and midwives, to help with testing and contact tracing.
We have been working since last week to increase our screening capacity, but this is not enough.
Indeed, these long lineups at testing centers in different cities, a reminder that while we're better prepared, there's still a long way to go. Jeff Semple, Global News, Toronto.